So I was in the car with my mom. We were just driving along, and then bam, we got rear-ended. And that's how I found out I had Parr's defect. Now, what exactly is Parr's defect? Parr's defect is also known as spondylolysis. It is a stress fracture, or a weakness typically found in the pars interarticularis, and it is typically found in the L5. Now here what you're seeing is an x-ray of my back. Now you can't really tell from the x-ray, but in my L5 there is a separation from the winged part of my backbone and the round part of my backbone. What are the causes of Parr's defect? First, there is overuse. Next is repetitive back bending. The next cause is specific to a spot on the vertebrae, which is called the pars interarticularis, and when that is thinner than normal, it can cause the Parr's defect. Another cause is quick, meaning faster than normal growth spurts. One cause that is not shown is that the Parr's defect, as it says in the name, is a defect. Anyone, as I was, can have had this from birth. Again, here is an x-ray of my back. As you might have seen as the picture was zooming out, the x-ray shows a small green line showing a section. I believe this is showing the slip in my back. I will talk about what this slip is specifically called next. Another disorder that can come from this is spondylolisthesis. Spondylolisthesis is when there is a slip in the vertebrae that has spondylolysis. From the fracture, it can come to a point where the vertebrae is slipping either backward, forward, or over the bone below it. I have both spondylolysis and spondylolisthesis, and from this, I have what they call a grade 1 slip in my L5 from both the defect and the car accident. Here is an MRI of my back. While I am not quite able to see where the spondylolysis is, this arrow is pointing to the area affected. Diagnosis of Parr's defect. If you have long-lasting localized back pain, this may be due to the Parr's defect. Of course, don't self-diagnose. X-rays, MRIs, CT scans, and nuclear medical bone scans are all used to diagnose. I personally had an X-ray and an MRI done. Here is a video showing and explaining where the Parr's defect takes place.
Spondylolysis refers to a defect in the vertebral column, and it's usually talking specifically about a defect in the pars interarticularis.
Treatment for spondylolysis can be any of the following. Resting from activity. This would be about 6 to 12 weeks from any activity, such as sports. You can also do physical therapy, which is what I did. There are also braces that you can get for immobilization of that part of the back. Finally, there is non-steroidal anti-inflammatory medicine. Here are some of the exercises you can do for physical therapy. First, there is bird dogs. You start on all fours, and then opposite arm and opposite leg extend out before returning to the starting position. You would do about 3 sets of 10. Next is crunches. With these, you tilt the pelvis and then proceed to do crunches as normal. You would do about 2 sets of 15. Next is dead bugs. These are similar to bird dogs, but on your back. Again, opposite arm and opposite leg extend down before returning to the starting position. You would do about 3 sets of 10. Next, there are planks. During my physical therapy, I would do about 3 planks that I was told to hold for 30 seconds. The final exercise are crunches with leg raise. Similar to crunches, there is a tilt in the pelvis. You proceed to raise a leg as shown and continue on with crunches as normal. You do about 2 sets of 15. There are other exercises that can be done for this defect. With spondylolysis and spondylolisthesis, there is also the potential for surgery. The most common right now is to fuse the damaged vertebrae to the bone below it to eliminate movement. The second option I was told about might be available in the future. The neurosurgeon called it spot welding, and he said that what they are exploring is to find a way to weld the vertebrae that has slipped back to the winged part of the bone in the pars interarticularis. Of course, this is still exploratory, and I haven't heard or seen anything else about it.